COVID-19 is a short name for a disease known as coronavirus disease 2019, discovered in December 2019 after recording a cluster of pneumonia case in the city of Wuhan in China. COVID-19 starts with droplets from an infected person's cough, sneeze, or breath. They could be in the air or on a surface that you touch before touching your eyes, nose, or mouth. That gives the virus a passage to the nauseous membranes in your throat. Within 2 to 14 days, your immune system may respond with symptoms including fever, cough, shortness of breath or difficulty breathing, fatigue, chills, sometimes with shaking, body aches, headache, sore throat, congestion or a runny nose, loss of taste, loss of smell, nausea or vomiting, or diarrhea. The virus moves down your respiratory tract. That's the airway that includes your mouth, nose, throat, and lungs. Your lower airways have more S2 receptors than the rest of the respiratory tract. So COVID-19 is more likely to go deeper than viruses like the common cold. Your lungs might become inflamed, making it tough for you to breathe. This can lead to pneumonia, an infection of the tiny air sacs inside your lungs, where your blood exchanges oxygen and carbon dioxide. One can get COVID-19 by coming into contact with a person who has the virus. To that effect, COVID-19 spread within China and to the rest of the world. And on the 30th January 2020, the World Health Organization WHO declared COVID-19 a public health emergency of international concern. And on the 12th March 2020, WHO declared COVID-19 a pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
As the pandemic continued spreading, Africa was hit and Zambia was not left out. On the 18th of March 2020, exactly 6 days after the declaration of COVID-19 as a pandemic, Zambia recorded its first 2 cases of the virus. And confirming the development to Zambia, former Minister of Health Dr. Shitalu Chilufya announced during a media briefing that the case involved a couple that traveled for a 10-day holiday to France with their 2 children.
Zambia has confirmed its first 2 cases of COVID-19 virus. The patients are a Zambian couple that traveled to France on a 10-day holiday with their 2 children. They came back on Sunday and they passed through our international airport, and because of our alert surveillance system, the travel history did pick that they passed through a country where COVID-19 cases were on the rise.
The fight against COVID-19 has seen vaccine development move at record speed, with more than 170 different vaccines in trials. Currently, Zambia only has 2 types of vaccines, namely Johnson & Johnson and Oxford AstraZeneca. The vaccines are aimed at reducing the risk of being infected by the coronavirus. Living in the era of COVID-19 can be scary, and there is a lot of misinformation out there. Here are some tips to stay safe and manage your health care during this pandemic. Wash your hands. Practice social distancing. Wear a face mask. Talk to your doctor before stopping any medication. Work from home if you can. Don't ignore your own symptoms. Understand your risk. Be prepared for telemedicine and take care of your physical and mental health.